Time for our Health Matters feature now, and today we focus on gout. Now, gout is a form of inflammatory arthritis that causes pain and swelling in your joints. It happens when there's a buildup of uric acid in your body. Gout most commonly affects your big toe joint, but it can also affect other joints, including your knees, your ankles, feet, hands, and wrists. Gout symptoms come and go in episodes called flares or gout attacks. Health professionals suggest medication and changes to one's diet that will lower uric acid levels and minimize how often you experience gout attacks in the future. So to discuss this, we are joined by Doctor Anelisiwe Magula, and it's a pleasure to have her. Dr. Magula, thank you. Thanks very much for joining us.
Good morning. Thank you for having me.
Gout is so common. It's unbelievable the amount of people I hear complaining about the fact that they've got gout. But I don't know if people really know if they've got gout or not. They just assume because they've got the symptoms. So perhaps maybe you can talk to us about gout and arthritis and how they are linked, and are they linked?
Yes. So gout is a type of arthritis. So there's different types of arthritis. There's inflammatory arthritis, which is the gout. And then you also get osteoarthritis and rheumatoid arthritis. So when you say arthritis, it's a very broad term to describe all these types of arthritis. The difference between gout and, say, for example, osteoarthritis, which is the common arthritis that we see, is that is mostly in your weight-bearing joints. So it's, for example, in your knees and in your hips and your back. That's the most common one for osteoarthritis. And it's mostly your joints become swollen, and they become, you will hear like it's a friction, like so it's like a creak or cracking in the joints, that people will describe with arthritis. I would say the common things that then it's also more painful. It's relieved by resting, and it's more painful after doing some physical activity for arthritis, whereas gout is more associated with more obese people. They have it's more in a singular joint, so it's not symmetrical. So you'll see people complaining specifically of one joint, and that when you present with that, then I would consider more gout than osteoarthritis.
Yeah. So, I mean, it's a big thing, but a lot of people, obviously, there's certain things that make gout flare up. So what are the things that affect it?
So people who have gout, the concerning thing is people who eat a diet that is rich in purines. So, for example, that's red meat, shellfish, things that also causes alcohol intake. There are also some medications that people take that causes a gout flare-up as well. So, for example, your diuretics and some other medication that people take that will. So you'll have to consult with the doctor to see what medication that you're taking that could be a cause for causing the gout flare-up. And then things such as also your increase in weight, renal kidney disease as well also causes a gout flare-up.
Amazing you haven't mentioned alcohol, because a lot of people think and assume that gout is directly linked to alcohol, but like really as a major function. I know you mentioned it, but some people think that is the direct link, is you drink and then you get gout.
Yes. It is associated with the gout flare-up. So gout we normally see in people who are obese and it causes a high uric acid. So alcohol is rich in purine, and that will then cause the flare. So that causes the uric acid crystals then to be deposited. So if you do have an episode of binge drinking, the gout, the uric acid crystals then deposit as well into your joints. So alcohol is definitely associated with the flare-up, but it's in people who are already predisposed with gout.
Yeah, and that's okay. So if you're predisposed to gout, what is it something that is in the gene pool? Is it something that you can pick up from your parents, or is it something that maybe develops due to these habits that you've been mentioning?
So gout, it's not a genetic condition. It's more a disease of lifestyle that develops later on in life. So the common test that we do is we do a blood uric acid. And if your uric acid is high and you have the symptoms, then we say that you have gout. So you have to have habits that cause an increase in your uric acid, but consistently, because then the uric acid deposits in your joints consistently. Then we say that you develop gout over a period of time. So the people who are at a high risk, or the people who are predisposed to that, are definitely the people who drink or people who have a diet that is rich in red meat. Then you are more predisposed to having gout.
Yeah. Obviously, the festive season is approaching, and people are really more likely to overindulge. So perhaps maybe you can give us a bit of advice for those that plan on. And honestly, it's the majority of us. We kind of press pause on the year and think that we can do anything at this time. So what advice do you give people at this time that are prone to it?
So I would say a big one is to hydrate, drink lots of water, to just keep the kidneys working, functioning well as well. So drink lots of water during this festive season. Try to eat a variety of food. Try to not only eat red meat. I know a lot of people go to functions and there's a lot of meat, but try to eat your vegetables so that by the time you're eating red meat, you are more full, that it's not too much. And then with binge drinking, I would also say try to have activities that are not centered around drinking. So like more physical activities, go for a hike, go for a walk, and don't center a lot of things around alcohol. And in between it is important actually to just hydrate.
Yeah.
And if you do and prepare yourself for flare-ups, if you are a person and you know that you have gout, then you should have your medication on hand. What your doctor prescribed to you, have it on hand as well.
Yeah, it is important. But I know there's some, there are some quick remedies, which I'll get to in a moment. But I just want to ask you, is gout reversible? Is it something you can get rid of, or is it something that stays in you and then just flares up now and again?
Yes, so it just, once you have a gout, once we diagnose you with gout, it will just flare up and go away. It is, once you start developing then the joint deformities, then that's obviously more permanent if you have a joint deformity. However, you can live a very healthy, normal life if you know you have gout and you take your medication and you are aware of the diet and the triggers as well.
Yeah, that I have heard this as well. But let's just say you have a flare-up. What do you do? I mean, I've heard lots of advice, like lift your leg or hold it higher, put ice on it, those kind of things. So if you are having a flare-up, how do we sort of get around that pain? Because it can be very, very painful.
Yes. If you have a flare-up, you are correct in saying that you rest, put ice elevated. So you want to reduce the inflammation as much as possible. So you can rest the joint. Especially if it's in your toes, you try to wear shoes that won't be so tight or that won't cause more pain to the toe or to the affected joint. And then in terms of medication, we give anti-inflammatories. So it's also just to reduce the inflammation in the joints. And there's medications like non-steroidals, which is for a short period. So those aren't medications that you should be taking for every day for all of December, but it's mostly for that period of time that you have the inflammation. So it's colchicine, non-steroidal anti-inflammatories, and those are the things that will be given by your doctor. But in terms of when it's at home or when the things to do by yourself, it's to rest, ice, elevate it, and wear things that are not going to hurt the joint more.
Oh, well, thank you. Thanks for giving us the advice. This is a medical practitioner, Doctor Anelisiwe Magula, talking to us about gout. So it is something that you just learn to live with, unfortunately, and when you have those episodes of a flare-up, you use some of the treatments that Dr. Magula had recommended. Thank you. Thanks so much for your time. I know it's a thing that does happen, particularly overindulging over this time. So just be careful, make sure you eat healthy and do all the things to try and prevent it.